Hello and welcome to Pregnancy Info. Today we're going to discuss the 10 signs of ovulation. Just about every person trying to get pregnant wants to know when it's ovulation day. Ovulation is when an egg is released from the ovary. When the egg is ovulated, you want sperms waiting in the fallopian tubes available to fertile the egg. Ovulation is the phase in your menstrual cycle when a mature egg is released from the ovary, setting the stage for fertilization. Every woman is born with millions of immature eggs that wait to be released, normally one at a time. Every month during ovulation, the egg travels down the fallopian tube where it may meet up with the sperm and become fertilized. For most healthy women, ovulation generally happens once a month, a few weeks after menstruation begins. How to predict ovulation? Whether you are trying to conceive or merely want to get to know your body's signs of ovulation, these indicators include at-home and OTC tests can help you learn how to tell if you are ovulating. Number 1. Basal body temperature monitoring, sometimes referred to as BBT. Your basal body temperature is the temperature of your body at rest. At the beginning of your cycle, basal body temperature remains fairly consistent and averages between 97.2 and 97.6 degrees Fahrenheit. As you get closer to ovulation, there is a slight dip in basal body temperature followed by a sharp increase, typically about 0.1 to 1 degrees just after ovulation. One way to know if you're ovulating is to track your basal body temperature over a series of months. Menstrual charting. Another simple and inexpensive way to track ovulation is to record the days your period begins and ends for several months. If you have normal menstrual cycles between 25 and 35 days, you're likely to be ovulating regularly, with ovulation occurring about 14 days before menstruation. Make sure to write down whenever you experience potential signs of ovulation. Ovulation kit, OTC or ovulation predictor kit, measure your level of luteinizing hormone, which can be detected in your urine. These kits work because ovulation typically hits about 10 to 12 hours after LH peak on day 14 to 15 of the menstrual cycle. If your cycle is 28 days long, your LH concentration should stay elevated for 14 to 27 hours to allow for full maturation of the egg. Here's how the ovulation kit works. Pee on the stick and wait for a line to appear. If the color of the line matches the shade shown on the instructions, ovulation is imminent within 24 to 48 hours. If it's too close to call, reset within the next 12 hours. Most kits come with a 5-day supply of sticks to be used in as many days, but check their expiration date. Most of them have a shelf life of only 2 years, while the majority of ovulation predictor tests can be used any time of day. Fertility monitor. While an ovulation predictor kit can identify when ovulation is expected to occur, giving you 24 hours for possible conception, a fertility monitor can identify your 5 most fertile days. The monitor measures LH and estrogen level to identify your 2 peak fertile days, plus the 1 to 5 fertile days leading up to them. Some versions of the monitor store information from your previous 6 cycles to customize your fertility reading. Be aware though that because monitors gives you more advanced information, they are pricier than ovulation kits. Ovulation symptoms. Now you are probably wondering, can you feel ovulation happening? And what exactly does ovulation feel like? It can differ from women to women, but there are several common ovulation symptoms you may sense. Before and during ovulation, hormonal shifts can affect the entire body, prompting ovulation symptoms. This can be a powerful way to know when you're ovulating. Many women will experience those ovulation symptoms for up to 5 days before ovulation. Number 1. Cervical mucus changes. Cervical mucus changes are one ovulation symptom you may experience. As you're near ovulation, your body produces more estrogen, causing cervical mucus to become stretchy and clear like egg white, which helps sperm swim to the egg that release during ovulation. Heightened senses. For some women, a more sensitive sense of smell in the later half of a normal menstruation cycle can be a sign of ovulation in this fertile phase. Your body is primed to be more attracted to the male pheromone, androstenone. Some women also report a heightened sense of taste. Breast soreness or tenderness. Tender breasts or sore nipples can be another sign of ovulation. Thanks to the rush of hormone entering your body right before and after ovulation, some women will experience this tenderness just before ovulation, while others may feel it right after ovulation occurs. Mild pelvic or lower abdominal pain. A lot of women wonder, can you feel ovulation? And for some, the answer is actually yes. Typically as a mild ache or pain in the lower abdomen, usually on one side or the other. So, what are ovulation pains like? Ovulation pain can feel like a sharp or dull cramp on the side of your abdomen where the ovary is releasing the egg. This ovulation side effects can last anywhere between a few minutes and a few hours. You might also experience light vaginal bleeding, discharge, or nausea along with the ache or pain, which is usually mild and short-lived. Light spotting or discharge. Brown discharge or spotting during ovulation is normal, if not that common. These ovulation symptoms can occur when the follicle that surrounds and protects the developing oocyte or egg matures, grows, and then ruptures, resulting in a small amount of bleeding. As blood gets older, it turns brown, which is why the ovulation discharge may range from red to dark brown. Libido changes. A change in libido is another common ovulation symptom. Some women notice that their sex drive increases during ovulation, which might be Mother's nature way of ensuring we keep the species alive and well. But as changes in the cervix. During ovulation, your cervix may become higher, softer, and more open. You can check your cervix along with your mucus for ovulation symptoms, using your finger to feel inside. Many women with a regular cycle right before ovulation, the cervix will be softer, like touching your lips. But after ovulation, it will feel harder or more like touching the tip of your nose. And we can also check for cervical changes using a speculum and help give you more guidance on how to do it at home. Nausea and headache. Many women ask, can ovulation make you feel sick? The answer is yes. Nausea and headaches are two possible ovulation side effects due to the change in your estrogen and progesterone levels. Changes in your basal body temperature. While you may not actually feel this symptom, it can still be a sign of ovulation. As mentioned before, your basal body temperature will rise during ovulation and stay elevated during that time. After tracking your basal body temperature for a few months, you will begin to more easily notice the patterns and identify noticeable changes. Positive ovulation test results. An ovulation predictor kit works a lot like an at-home pregnancy test. You urinate on the stick or into a cup in which you place the stick or test strip. Two lines will appear. When the test line is darker than the control line, the test is considered positive, indicating that you are likely about to ovulate. This is a time to have sex to get pregnant. Saliva Ferning pattern. A ferning pattern in your saliva is another possible sign of ovulation. A unique and uncommon way to detect ovulation. A ferning pattern looks like frost on a window pane. There are specialized microscopes sold for this purpose, but you could technically use any toy store microscope. Some women have difficulty detecting the ferning pattern because it's an unusual way of tracking ovulation. You won't find many resources and peer spot. The ovulation window. On average, a woman with regular cycles tends to ovulate sometimes between day 11 and day 21 of her cycle. If your cycles are on the shorter side, you are more likely to ovulate closer to day 11. If you have longer menstrual cycles, ovulation may occur closer to day 21, but sometime between day 11 and day 21 is quite a long range. If you want to know the method to detect the ovulation days, then we will make a video on it. And if you like this video, must share it with your friends and family members. Thank you.